the excessive secretions and your hyposecretions of all of these hormones. Okay, that's the very problem there. Your hypo, whether it's hypo or whether it's excessive or your hyper secretions, dun ka nagkakatalo because, in understanding your human body metabolism and in understanding the process, you have to understand that there should be stable hemodynamics. Now, once there is an imbalance, that's where you are going to have your negative feedback mechanisms. That's where you have your manifestations of all of the signs and symptoms. Now, that is also the same. That is very, very true when we're talking about your endocrine gland disorders, because your hormones are there because they would like to maintain that hemodynamics or your homeostasis pala, ibig sabihin nun. You would like to maintain that homeostasis. So if you have any problems with just even one gland, you're going to be putting a break or maybe putting an imbalance in that homeostasis that we're talking about. So sabi ko nga kanina, most of the problems is either about your oversecretion or your undersecretions. So if you have your hypothalamus, all of the hormones there can either have your hypo or your hypersecretion. That is also true when you are talking about your pineal gland, your pituitary gland, whether it's anterior or posterior. You also have your thyroid gland, you have your parathyroid gland, you have your thymus. Thymus doesn't have even much of a problem. Okay? And then you also have your adrenal glands. Yan, marami din problema sa adrenal gland. And you have your pancreas. As you can remember with our discussion in your pancreatitis, whether it is your acute pancreatitis or your chronic pancreatitis, whether it is your exocrine or your endocrine, di ba sabi ko, yung exocrine natin is very much focused on your gastrointestinal function. Now, we are done with your pancreas as a gland which provides your exocrine enzymes, okay, your exocrine hormones. Okay, now we are going to be focusing on your pancreas now as an endocrine gland, and therefore, basically, this is your islets of Langerhans, and that is your insulin and your glucagon. Okay, and you also have your ovaries and your testes, but I would not be discussing your ovaries and your testes because I would like to think again that this has been discussed to you in your maternal and child nursing. Okay, the reproductive system ito, reproductive management of this particular disorder, dapat nandoon na siya sa MCN. So, I will not review anymore on your ovaries and testes. I am going to be discussing, okay, ito, okay, your thyroid, your parathyroid, your adrenals, and most especially this. So, you have 1, 2, 3, 4, 5. Okay, yan ang i-discuss ko for your endocrine glands. So they're the more, not more, but they are they frequently asked questions in board examinations and in most very frequent disorders found in the local setting and then also in hospitalizations or hospitals and institutions all over the world. So we'll just focus on this one kasi maraming problema ang endocrine, kaya lang i-zoom in natin doon sa very, very common. Okay, so the basics. Okay, so that is your endocrine gland. Now, the first thing that we are going to do for any type of your endocrine disorder is to do your system assessment. So, this is basically doing your job as a nurse who will be doing your physical examination. You'd like to do your patient history. Ito yung mga dapat itanong mo. Because the coverage of the disorders of your endocrine gland is far and wide. And it's very expansive. So we try to pick the general assessment or general manifestations that can be seen with your endocrine gland disorder. So the first one on the list would be, actually, let me, 1, 2, 3, 4. Tama ba? Ayan. Yan. 1, 2, 3, 4, 5. So you have your assessment for your growth imbalance. Remember your growth hormone. Okay, so you have always are going to evaluate for your obesity because there are some types of your hormones which has manifestations of your truncal obesity. Okay, and that would be your Cushing's disease or your Cushing syndrome. Your assessment of your abnormal, yes. If you have written there, I cannot see your message. You can just tell me what you have written. Kung sino ka man. Hindi ko makikita yung message mo because I am using your full screen. Okay? And if you are saying attendance, yes, you are in. However, you don't get the 5 points. I'm sorry. Okay, let me go back. So we have here your assessment of your abnormal skin pigmentation. I will be explaining this one later on, because this is, one of the manifestations for your adrenal disorder, which is your Addisonian disease or your Addison's disease. You also have your evaluation for your appetite change. I mean, let me skip already because sa susunod na slides, we have the specifics. So we have, okay, number 1, assess for your growth imbalance. If you are familiar with, 7-footer, 9-footer people, which the Filipinos are not, I'm sorry, hindi po tayo yaan kasi medyo pandak po ang Filipinos. This is basically what we're going to be assessing, especially if there is your oversecretion of your growth hormone. And this is a case of a patient suffering from your gigantism and your dwarfism. Both of them are. I even have, if I can find that specific Facebook video regarding a patient who has suffered both types of imbalance. Ibig sabihin nun, in the span of his lifetime, he had experience being, a patient of dwarfism and at the same time, gigantism. Isa lang siya, isang pasyente lang yun. Hindi 2 patients, basta isa lang siya. And he has experienced that one. I'm going to try to look for that video because I think I have uploaded this somewhere in my anatomy and physiology class before. So I would share that one to you. Sana mahanap ko. But when you're going to do system assessment, one of which is to check for your growth imbalance. Now, you have to understand that problems with your gigantism happen, in the adolescent or childhood. And then you have your acromegaly, if you can still remember, when you're talking about your acromegaly, malaki yung mukha niya, malaki yung bones niya, yung jaw niya, malaki yung kamay niya. Okay, so similar manifestations also with your gigantism. So that is, these are actually one of the manifestations that you're very much going to be looking for when you're going to have your system assessment. So you would like to find out if there is your excessive growth, excessive secretion of your growth hormone. So that's why you end up having your gigantism. Or if there is your retarded growth. Okay, growth hormone. And that is basically what you see there, yung katabi ng ating patient with your gigantism. That's where your dwarfism. Okay, sino ba yung artista sa Game of Thrones who became very, very popular? And height did not matter to him because he's still a Hollywood celebrity. If you know, sinong may alam ng pangalan niya?
Tyrion Lannister, ma'am.
That's the name of the character, not his real name. Anong pangalan niya? Oh. Yes. Oh, anong pangalan niya in real life? I've seen so many movies of him, and being small or being very short did not bother him. He was not, he did not go, he went against the standards of Hollywood that you need to be, you need to be tall, you need to be good looking and everything. But, that's him, Peter Dinklage. Meron din siya sa Avengers, di ba? If you can remember.
Yes, ma'am. Malaki siya dun.
Malaki siya dun. Okay. What an irony. But yeah, okay. It works. So that is for your assessment of your growth imbalance. Now, let's move on. Ayan. Evaluation for obesity. This is not related to your gastrointestinal, not basically related to the primary problem in your gastrointestinal system, but this is related to the problems of your hormones. Your hormones causes you to have your obesity. An example of this manifestation, nang nagkakaroon ka ng truncal obesity, I'm talking about truncal. Ayan. Obesity. Truncal, ibig sabihin sa may trunk mo, sa core mo. If you're going to draw a person who, from head to toe, cephalocaudally, yung pinaka-trunk mo, from your head until your hips, yan ang trunk mo, di ba? Yan, you are going to have your truncal obesity. And an example of a disease that causes this truncal obesity, that one, ayan itsura niya. This is a person who has your Cushing's syndrome. Okay? Cushing's syndrome. And this is an oversecretion of your cortisol. Okay? Oversecretion of your cortisol. And this cortisol um, likely expands or likely causes you to have your obesity. Okay, and if you can see, look at that. Yung itsura niya, yung mukha niya, you call that your moon face. Full moon face, okay? And then we also have yung you also have these manifestations. Yan, yung sinasabi nating buffalo hump. Yan. This is a same person with your manifestations for your Cushing syndrome and nung na-resolve na yung Cushing syndrome niya. Ayan. Ito ang tinatawag nating buffalo hump. Yes, it is actually seen among patients who are obese. Okay, but for this particular scenario, the patient is suffering from obesity because of that oversecretion of hormone. Okay? Ang may kasalanan dyan, yung cortisol natin, your ACTH natin. Okay? Your adenocorticotropic hormone. So that is to evaluate your obesity. Okay, then as you can see, meron siyang maraming striae dito. Yung mga stretch marks natin. But once your Cushing syndrome is resolved pala, mawawala na yan. Okay, mawawala yan lahat. Okay? Next, what other system assessment do you need to do? Assess for abnormal skin pigmentation. Yes, we have discussions about, I think in your case, hindi ako nag-handle sa inyo ng infectious saka integumentary disorder. So if you can still remember, in NCM 112, there were discussions about your integumentary disorders and also the manifestations or these several types of your lesions. Now, yung skin pigmentation na sinasabi natin can be attributed to your vitiligo or maybe your yung mga rashes natin, yung mga hives natin. But in this case here, this is very, very abnormal. Again, it's relative to the oversecretion, okay, or maybe undersecretion of your cortisol. In this particular case, this is the exact opposite of your Cushing's syndrome. Kung ang Cushing syndrome natin, malaki. Okay, huge build, you have your truncal obesity. Actually, yung limbs ng ating Cushing syndrome, payat sila. If you're going to draw a person who has your Cushing syndrome, so very big face, very huge body, but very thin arms and very thin legs. Ganyan ang Cushing syndrome naman natin. Now, when we're talking about the exact opposite of your Cushing syndrome, which basically is an undersecretion of your ACTH hormone or your cortisol for that matter, you are going to end up with a person who is very thin, okay, very frail, okay, and has your abnormal skin pigmentation. Ano meron doon sa abnormal skin pigmentation nila na sobrahan yung stimulation ng melanocytes natin. Okay, and again, this is because there is your domino effect of the undersecretion of that cortisol in the patient's body. So you end up with having your abnormal skin pigmentation. Ayan. Yan. Skin pigmentation, mostly doon sa may palmar area natin. Meron din dito sa may gum part natin. But imagine nyo lang, nog-nog yung pasyente mo, ganon. Okay? And that is not normal because initially before there was your diagnosis of your Addison's disease. You call it your Addison's disease. Addison's disease. Okay? There is your bronze, okay? Bronze skin pigmentation. Okay? And at the same time, you also call this one as your Addison syndrome. Okay, same lang siya. But what can be manifested with this disease is that abnormal bronze pigmentation. Initially, the patient did not have that. Normal, fair lang yung kulay niya. But because of that disease, nagkaroon siya ng abnormal skin pigmentation. And that is because of your hormones, undersecretion of the hormones. So, kung hahanapin mo yung etiology, ang may kasalanan niyan, yung hormones ng pasyente. Okay? Next, another skin pigmentation na makikita mo relative to your endocrine is the, what we call your hyperurochromatization of the legs of patients who have your DM. diabetes mellitus. If you know of somebody in the family who has been suffering from diabetes mellitus for a long period of time and hindi siya, that patient is not managing his or her blood glucose properly, you would look at the legs of these people at makikita mo nangingitim sila. Okay, that's why we end up having your amputation. Diba? We end up having your gangrene. Kasi nga, unti-unti na pinapatay or there is problems already with your circulation and with your tissue perfusion on that specific area. And we can associate that abnormal skin pigmentation due to the fact that there is so much of your glucose in your system and your insulin is not working properly anymore. Okay, so that is for your DM. So aside from your Addison's disease, you also have your diabetes mellitus. Okay, and in diabetes mellitus, buti sana kung bronze pigmentation lang yon. Okay, or your darkening of that your limbs, your lower limbs. Hindi eh. Aside from that one, makati pa siya. Okay, so you also have your pruritus for that matter. So that is for your letter C. Let's move on for your letter D. Evaluate appetite changes. Now, this can be very much seen in patients who have your hyperthyroidism. Okay, because in your hyperthyroidism, obviously, you are going to be expecting a lot of your T3 and your T4 hormones, and you have to understand that your T3 and your T4 hormones are responsible for your metabolic processes. So kapag masyadong mataas yan, ibig sabihin nun, your metabolic process is also very, very fast, which would demand, your body would demand you to always eat and eat and eat and eat so that it would catch up with the demand, okay, of that metabolic process, which is very, very, very fast. Okay, in like manner, so that is for your hyperthy. Okay. Now, in like manner, if you also have a person suffering from your diabetes mellitus, remember, when you have your diabetes mellitus, it's either yung insulin mo hindi na gumagana or yung tissues mo hindi siya sensitive doon sa insulin. Okay, there is resistance already to insulin. Ganon yun. Lack of insulin or there is resistance to your insulin. So technically, if you have problems with both, you're going to be having, problems with your glucose control. Kapag walang glucose sa katawan, okay, if you do not have glucose in your cells or your tissue, it means to say all the energy is lost. Okay, so therefore, as a negative feedback mechanism, your body is going to respond. Your body is going to tell your brain, hey, you need to eat because we are very weak. We don't have glucose in our tissues. Okay, yan yung nangyayari sa diabetes mellitus. Unfortunately, with your diabetes mellitus, okay, there's enough glucose. However, it cannot go to the cell because there's absolutely no insulin or there is your increased resistance to your insulin by your cells itself. Okay, so that's the problem. So therefore, kakain ka na ng kakain, tataba ka ng tataba, but still, you have problems with your sugar. Okay, you have problems with the glucose not going to your cell, into your cell. So it's like a loop. Kaya nga sinasabi nila, it's one of the chronic, very, very common chronic disorders in the Philippines. One of the top 10 morbidity and mortality in the Philippines. Okay? Next. Yan. So, if I can remember it correctly, for diabetes, we call this, appetite changes, polyphagia. Polyphagia is your excessive eating. Okay? This is like the body's response to compensate for the lack of the glucose that is not entering your cell. So for clients who have your DM, ito ang this is a very, very common manifestations for them. Okay, so you're going to actually put that in your patient history. Okay? Next, we have, assess for mental changes. There are some types of your endocrine disorders which have complications. Okay, yes, we would understand that hormones cannot be cured. I mean, it's very difficult to manage it because it's like trial and error. We need to put balance in the excessiveness or in the hyposecretions of these particular hormones. Okay, and then there are instances wherein patient na alam mo meron kang problem ng endocrine hormones, you refuse to take your hormone replacement therapy or you refuse to take the medicines which would try to inhibit the secretion, over secretion of these hormones, okay, you end up with having these several complications. And one of these complications are your myxedema coma, or even your thyroid storm, or your thyrotoxicosis. Thyroid storm, or your thyrotoxicosis. Tong dalawang to, ang may kasalanan yan is your thyroid gland. There is no balance there. There's over-secretions. There is under-secretion. Lahat yan, manifestations would include level of conscious changes in the level of consciousness. There would be instances wherein the client would have differences in the manifestations of your GCS, from being very active, very oriented, tapos magiging stuporous na siya hanggang sa magiging coma na siya. And that is again a medical emergency. So if you're going to check for your mental status changes, okay, that is one of the things that you would be very, very much particular in, especially if you're going to do the assessment and interview of this specific patient, especially if you are assigned in the emergency department. Okay, kasi kailangan na, you must have a very, very keen eye. Isang tingin pa lang sa pasyente, alam mo na kung anong problema niyan. Okay? So that is for your mental status changes. In thyroid gland problems, you also have your manifestations of hyper-excitability. Laging anxious yung pasyente mo, laging restless. And that is a manifestation of a patient who has your hyperthyroidism. Okay, hyperthyroidism. And then another thing is you also have mental retardation. Meron din mga ganun problems with the hormones natin. Okay, and then also your mental confusion, as I've mentioned, you have here your myxedema coma and your thyroid storm. In the ICU, we have several of these patients na meron silang history of 10 years having your hyperthyroidism, and then did not follow through with taking the medication, especially your hormone antagonists. Okay, hormone antagonists. So, tapos hindi pa nagpatanggal ng thyroid gland. So, ito yung mga problems natin sa clinical area. So, they end up in the ICU because they are suffering from already the complications of non-management of the disease. Okay? So, next we have your metabolic status. Sabi ko nga kanina, when you're talking about your thyroid glands, they are very much responsible for your metabolic processes. And when I say metabolic processes, lahat po ng processes sa katawan mo. That would include your metabolic status. Okay? Kasi metabolism, very, very obvious naman. So kapag ikaw ay mag-handle ng pasyente na merong hyperthyroidism, ang metabolic process ng taong yan is very, very high. So all of the things that the client feels is actually hyper. So meron kang hyper-irritability, meron kang weight loss kasi nga ang bilis-bilis. Swerte naman sila pero actually no. Okay, kasi nga, di ba kakain ka lang tapos ang bilis-bilis ng metabolism mo. That is, one of the manifestations for patients who have your hyperthyroidism. Now, if you're going to talk about a patient who has your hypothyroidism, from the term hypo, it means to say your metabolic process is also very, very low. It's actually going down. So if you're going to think about the metabolic process of a client who has your hypothyroidism, masyadong mabagal lahat. And that would also include, your GI metabolic process. It's very, very slow. So if you're going to compare a patient who has your hyperthyroidism at saka hypothyroidism, you would know who has hypo and you would also know who has your hyper. Sa hyper, payatot siya kasi everything is just very fast. Sa hypo, mataba siya because everything is very, very slow. Okay, and that would be, one of these system assessment that we need to do for our patients. Okay, next we have your assess for coma state. I have mentioned that one already. Your coma state, that is for your myxedema coma. Aside from the LOC changes, yung mga example ng mga patients namin na merong coma state, okay. An example of that is a complication of your diabetes mellitus, which is what we call your DKA. Okay, this is your diabetic ketoacidosis. Okay, let me write that one down. Keto. Familiar guys, yung mga nagda-diet dyan. Keto diet, di ba? Acidosis. And I'm sure you're also familiar with your acidosis. Okay? Remember our discussion about your acid-base imbalances. So, ibig sabihin, a client who has your diabetic ketoacidosis is suffering from the complication of proper non-management of the disorder. Okay? You end up, okay, remember, a client who has your diabetes has problems with your glucose level. Glucose that do not enter your cell, glucose that is not consumed by your cell. But unfortunately, you have a lot of glucose in your circulation. So there is constant hunger or starvation of your cell for a client who has your DM. So ano ang gagawin ng katawan as a negative feedback mechanism? And it's trying to still maintain that homeostasis. Okay, so ang gagawin niya, instead of actually, from the term keto guys, keto, okay, instead of actually consuming your glucose, it would try to look for other ways and means what they would use for that metabolic process. Okay, so that you would not have cell hunger. So ang gagawin niya, magkakaroon ka ng fat metabolism. Okay, unfortunately for a client who has your DM type 1, because this is a complication for DM type 1, ang problema dyan, apart from, yes, you might have solved the problem for the glucose, insufficiency inside the cell, but you would end up having your acidosis as a result of that fat consumption. Okay? It's very fine if ang pasyente mo walang DM. Yung tipong nagda-diet ka lang, kaya nga meron tayong tinatawag na keto diet, di ba? If you have read articles regarding this, I think they're focusing a lot on your good fat. Yan, yung sabi nila, consumption of good fat and not less of your sugar. Okay? Which actually I think works for some people. Majority of the people I've read, yun nga. Pero, kung ikaw ang pasyente na may your diabetes mellitus, and this is not just basically about being on a diet for a healthy individual. You're going to be suffering from acidosis because with your acidosis, you are likely having a lot of your lactic acid, and it's going to be circulating all over your system. And eventually, you might end up in a coma state because you have not done something about the very, very high levels of your sugar. Okay? And there is already a repercussion of this lactic acid circulating in your system. So that is assessment of your coma state. Marami tayong mga pasyenteng nagkakaroon ng manifestations for your coma because of the complications. So you can always go to the understanding of how these disorders and have end up into your coma state. Okay, next we have, yan. Do you have any questions for the system assessment? This is actually in general, because each of these manifestations will be discussed later on pa. Okay? If there are no questions for the system assessment, let's move on to your diagnostic examinations. So, since the hormones are actually, free-flowing in your circulation, we would like to find out if there is problems with your over-excessive secretion or your hypo-secretions. So one of these diagnostic examinations is what we call your suppression test. Okay, your suppression test. Now, from the word suppression test, ginagawa mo to because you would like to find out if there is over-secretion of these particular hormones. So, if there is excess hormone that is being secreted or that is being circulated, you might want to do your suppression test. Like example of this is your hypersecretion of your cortisol. Masyadong madami yung cortisol natin due to the fact that hyperactive si ACTH natin. So kapag masyadong madami si cortisol, ang gagamitin natin is your dexamethasone suppression test. This is just like a blood test. Okay, this is just like a blood test wherein it would like to find out if there is large amount of your cortisol in your system. Okay, they would like to find out if there is large amounts of cortisol in your system. In like manner, you also have your hypersecretion of your growth hormone. Kung masyadong madami ang growth hormone natin, you have this one specific test that can be done to your patient, and this is via your oral glucose tolerance test. Familiar, guys? I think, I hope you have discussed this one. For your pregnant women, they would like to find out if there is your, diabetes, the pregnant women. And this is also very true for patients who have your diabetes, your oral glucose tolerance test. Can you remember how it is done? Na-discuss ba to sa MCN? Was this discussed in your MCN, maternal and child nursing? No? Hello? Andiyan pa kayo?
Na-discuss pa.
Na-discuss. O paano siya ginagawa? Can you still remember? From the word, oral glucose tolerance test. So, how is it done? Naalala pa?
Ma'am, yung 3 times blood extraction po.
Ma'am, pinapainom ng glucose syrup, ganun, ma'am.
Ilang milligram?
100 gram, ma'am.
100 to 150. Okay?
75.
100 to 150. Tapos, apart from, di ba pagkatapos iinumin, there is a time frame for this one. Kaya nga sinabi nyo kanina, 3 beses. So, ano yung time frame na meron para sa OGTT natin?
Ma'am, 1 hour po.
1 hour lang? Hindi ata 1 hour lang yun eh. 60, 90, 120 minutes. Kasi 3 times, guys. 60, 90, 120 minutes. Ganun ka, yung alternating time for extracting the blood and at the same time providing that juice, which is 150 grams of your sugar. Yan yung binibigay natin. And then if, for example, there is a high level of your glucose there, well, that means to say that there might be hypersecretion of your growth hormone, and at the same time, there will be problems with your glucose, okay, glucose management in your client system. So that is for your suppression test, okay? Suppression kasi gusto mo, you want to put a stop to it. You want to make sure na this is something that is abnormal. So kapag nagbigay ka ng suppression test, gusto mong ipa-stop temporarily. Okay. So, ang expected effect dyan is kapag nagbigay ka ng dexamethasone or maybe, this OGTT, dapat parang yung parang normal lang yung level niya. Pero hindi. Kapag masyadong mataas, ibig sabihin nun, hindi effective yung suppression na ginagawa ng ating yung mga gamot natin or even your orange juice. Okay? Kung ikaw ay normal na individual without problems with your hormones, your manifestation would be normal. Normal lang dapat. Pero if you have problems with your your endocrine gland function, then you will have excess, very high, very, very large amounts. Okay? Very, very large amounts of your cortisol, for that matter, even your growth hormone, for that matter. So that is your suppression test. Now, kapag baliktad naman tayo. Kapag there is your hyposecretion, there's no secretion at all, what you would like to do is to have your stimulation test. Okay, you would like to have your stimulation test. Kapag meron kang deficiency, kailangan mong ma-identify and recognize na, okay, ito talaga kulang. May kulang talaga sa kanya. There's problem with the hormone secretion. So what you would like to have is a stimulation test that would actually confirm that there is really problem with your hormone deficiency. Now, one of which is your insulin stress test. When you have problems with your cortisol secretions, you have your insulin stress test. It's very much the same with your OGTT. Okay, very much the same with your OGTT, and it's actually one of the gold standard. Okay, let me write that one. It's a gold standard. Baliktad. Okay. Gold standard diagnostic examinations for ACTH problems or your cortisol problems. Ayan. So, it's similar to your OGTT, but instead of providing the client your orange juice, which is 100 to 150 grams of sugar, ang ibibigay mo dito is your insulin. Kasi nga gusto mong malaman kung meron ba talaga siyang meron ba talaga siyang deficiency doon sa cortisol natin, or kung kaya ng katawan niya na mag-produce ng cortisol. Kung ang lumabas doon ay wala, ibig sabihin nun, yeah, it is very true that there is your deficiency in your cortisol. In your insulin stress test, you will have your extraction, blood extraction for 4 times, if I'm not mistaken. 4 times. Kung sa OGTT tatlong beses kasi 60, 90, and 120, doon sa ating insulin, you will have 30 every 30 minutes, 30 minutes, 60 minutes, 90 minutes, and 120 minutes, mag-extract yung ating medtech ng blood. Okay? After the client has been given your insulin. Okay? So that's your insulin. Kaya nga, insulin stress test. The insulin, there is your goal here is to forcibly demand the body to release your cortisol. Kasi nga walang cortisol si pasyente, wala siyang sugar. Ngayon kapag pag binigyan ka ng insulin, ibig sabihin nun babagsak yung sugar level mo, no? For a normal person, dapat magka-create si body ng cortisol. There should be a secretion of your cortisol. Kaya lang, since sa patient natin ay may problema sa cortisol, makikita mo na, okay, that insulin stress test is effective because it really confirmed that the client is unable to use your cortisol. Okay, kaya we call it your insulin stress test. Now, in like manner also, if we have your deficiency in your growth hormone, ang ibibigay natin sa patient dito is your glucagon test. Okay? Your glucagon is actually found where? Who produces your glucagon? Guys, who? Which part of the body produces your glucagon? Hello? Naalala pa? Yes. Wala. Which part of the body is responsible for the production of your glucagon? Diyan pa kayo? Baka nawala na naman ako. It's your pancreas. Your pancreas is responsible for the release of 2 endocrine hormones. Your hormones in your endocrine glands. One of which is your insulin. It's in the beta cells of the islet of Langerhans. And the other one is your glucagon. Okay? Your glucagon is actually released kapag sobrang bagsak. Okay? Sobrang bagsak ang ating blood sugar level. If you can't remember again your anatomy and physiology, your insulin is actually released if there is very high sugar level because it would help out in toning down or in reducing that sugar and in allowing this glucose to go inside your cells. But in the event that there is a drop in your sugar level, okay, what will be kicking in here would be your glucagon, and this is produced by the alpha cells, okay, of your islets of your Langerhans. Okay? Now, with your glucagon test, anong problema dito? Wala ka po masyadong sugar. So, isi-stimulate ng glucagon test. Ano yung stimulate niya? By the way, your glucagon, how does its job? Paano niya ginagawa yung trabaho niya? How will it actually increase your sugar level in your body? Considering that your glucagon is actually that resolution hormone to correcting your drop in your sugar level. Ano ang ginagawa ni glucagon? Paano niya ginagawa yung trabaho niya? Can you still remember? Guys, this is a part of the discussion in biochemistry. Nakalimutan nyo na? Yes? Hello? Andiyan pa kayo? Paano po? Yes. Wala na. Wala nang natandaan. Anatomy and physiology, biochemistry. How does glucagon do its job? Anyone? Hello? Andiyan pa ba kayo? Come on guys, you need to answer. Baka na naman ma-assume ko ang sarili ko na wala na naman akong internet. Yes. Anyone? How does glucagon do its job?
Ma'am, how does glucagon ma'am?
Ha? Hello? Can you hear me?
Ma'am, ano po? Yung sa last part, ma'am, how does glucagon...
Do its job. How does glucagon increase your glucose level? Your glucagon is actually secreted when there is your decrease in glucose level. It's the exact opposite of your insulin. Okay, uulitin ko. Your insulin does its job, okay, by allowing your glucose to go in the cell. Therefore, that would decrease your glucose in your circulation. Tama. That is your insulin. Kasi nga, pinapababa ni insulin yung glucose sa circulation mo. Kasi ang ginagawa ni insulin, hinahatak niya si glucose papasok sa cells ng tao or tissues ng tao. Ngayon, when you have problems with a drop in your glucose, ang bida dito ay si glucagon. Now, paano ginagawa ni glucagon yung trabaho niya? Paano niya tinataas? How does your glucagon increase your sugar level? Yes. If there is your drop in your sugar, if there is your hypoglycemia, how? Wala na ata kayong natatandaan sa anatomya and biochemistry. Wait, let me call people.
Ma'am, try.
Yes, try.
Yung mga yung na-store sa liver na glucose, yun yung ginagamit na
Anong tawag mo doon? Anong tawag mo doon? Correct. Anong tawag mo doon? Yes. Hindi, yung glucagon galing sa pancreas mo. Ano yung na-store na liver na sugar or yung glucose? What do you call that?
Glycogen.
Correct. It's your glycogen. Glycogen. Pero para maging sugar si glycogen, anong process ang tawag doon? So that your glycogen will be converted to sugar, it will have to undergo...
Glycogenolysis.
Yes, there you
Glycogen.
go.
Hey!
Glycogenolysis. There you go. Very good. Nakalimutan nyo na ata itong mga to eh. Kasi lysis of your glycogen. Okay, and the end product of that is actually your glucose. Did you get it? Okay, so for example, if you're going to do a stimulation test of a patient who has deficiency in your growth hormone, maingay siya. Okay, so if you are going to do a stimulation test, for a normal person, if you have low sugar level, immediately your glucagon will kick in. But since there is problem with your endocrine system or there's problem with your endocrine gland, walang glucose na makakreate dyan kasi kulang ka nga ng growth hormone. So, your stimulation, you would like to give that stimulation test so that kapag merong yung glucagon test, lalabas yung glycogen, mangyayari din yung glycogenolysis, and there is going to be your glucose. Mag-i-increase siya. Okay? But that is because of that test and not because of the client's innate and natural release of your glucagon. So that is your stimulation test. Your stimulation test needs a particular substance that is going to be administered to your patient so that it would create a specific type of reaction. And that is your stimulation test. And again, it's still a part of your hormone problems. And it's still trying to confirm if there is really your deficiency or if deficiency kasi stimulation test ito. Okay, so that is your assessment of your diagnostic test.